Hi, my name is MediStop. In this episode, we will talk about subarachnoid hemorrhage. Subarachnoid hemorrhage is a traumatic event, characterized by the presence of blood into the subarachnoid space. This is a life-threatening illness that affects young patients between 40 and 60 years old. 33% of these patients die before reaching the hospital, whereas 33% have irreversible neurological deficits, and only 33% have minimum neurological disabilities. What is the subarachnoid space? Between the brain and the skull there are three layers, called meninges. The outermost layer is called dura mater, the middle layer is arachnoid mater, and the innermost is the pia mater, which has a direct contact with the brain tissue. Between the arachnoid and the pia mater, there is the subarachnoid space, which normally is full of cerebrospinal fluid. Here we will find the subarachnoid hemorrhage, under the arachnoid layer. What causes this dramatic event? There are two possible causes. The most common cause of subarachnoid hemorrhage is a rupture of a vessel aneurysm. An aneurysm is a saccular dilatation of the wall of the vessels. This can be a consequence of other disorders, such as Marfan syndrome or Ehlers-Danlos syndrome, both attacking the collagen structure of the vessels. This sac has a thinner wall compared to a normal blood vessel. More precisely, it lacks the elastic layer of the wall, so this will make the blood vessel more fragile and susceptible to rupture. This dilatation is usually spotted on the circle of Willis. In over 85% of aneurysms is in the anterior region, affecting the anterior communicating artery. It can also involve the posterior communicating artery, or the vertebral artery. The second important factor is an arteriovenous malformation. This defect is a fistula between the venous system and the arterial one, causing high pressure on the walls of the veins. The vein structure is not capable to resist to the arterial pressure, so it is predisposed to rupturing. Nevertheless, there are some risk factors we can acknowledge. High blood pressure, also known as hypertension, is the most important. A stressful period, combined with a non-diagnosticated or a poorly treated high blood pressure, can determine the rupture of the aneurysm. Smoking, excessive alcohol, or chronic anticoagulant medication can also play a role in the aneurysm rupture. The clinical picture of the subarachnoid hemorrhage is pretty complex, so if you want to remember these symptoms easily, use the mnemonic spider. Hint: spiders are part of the arachnid species, which is also the word used for arachnoid mater. S stands for severe headache, that occurs suddenly, and it is an extremely painful type of headache. The patients often say that it is the worst headache they have experienced in their life. It can be associated with nausea and vomiting. P stands for photophobia. The patient has eye sensitivity to brighter lights. I stands for irritability. We can also see confusion or other personality changes. D stands for dizziness. E stands for encephalopathy. We can see that the patient has brain dysfunctions, which sometimes can be spotted as induced seizures. R stands for rigor nuchalis, also known as intense neck stiffness, which is an irritation of the meninges due to the presence of the blood in the subarachnoid space. So, these are the spider symptoms. Subarachnoid hemorrhage can have many complications, but there are four important ones. First, we have the re-rupture risk. If the aneurysm is untreated, the re-rupture occurs in 30% of the cases in the first month, with a peak in the first 7 days. This risk is associated with a greater mortality and poor outcome in over 60% of the patients. The second complication is the hydrocephalus. This means that the brain ventricles have excessive cerebrospinal fluid and will become bigger. This will put pressure on the brain tissue and can cause damage on the structures underneath the ventricles. The patient may experience drowsiness and a lack of will to do anything, this also being known as abulia. Vasospasm. The surrounding blood previously released during the acute bleeding will decompose over time. The substances found in the blood residue will irritate the nearby vessels, making them to narrow. This process is also known as vasospasm. This will lead to symptomatic ischemia and infarction of the affected territory. The vasospasm appears after 4 to 14 days after the first hemorrhage. Last but not least, there is an electrolyte disturbance, hyponatremia. This happens because of an inappropriate secretion of antidiuretic hormone, also known as SIADH. This complication can be quickly found in the first 2 weeks after the bleeding. When a patient presents with severe headache, vomiting, or seizures, we should rush him to get a CT scan, given that this condition is a life-threatening event. The sensibility of the CT scan is very high, being at its highest in the first 24 hours of the hemorrhage. The lumbar puncture is another option for the diagnosis, but it is used only if the CT is not conclusive. We shall see a yellow color of the cerebrospinal fluid, which lasts for 2 weeks. The catheter angiography may reveal an aneurysm or another source for the bleeding. This technique has double function, used for both diagnosis and treatment. We will talk about this in a moment. Subarachnoid hemorrhage requires rapid treatment. The first-line therapy for this illness is the endovascular coiling. More precisely, through a catheter, the doctor will introduce small platinum coils in the aneurysmal sac. This will promote the thrombosis and the closure of the ruptured aneurysm. This procedure is called catheter angiography. In addition to angiography, nimodipine, a calcium channel blocker, is usually used. Nimodipine reduces mortality and improves the general outcome by dilating the affected vessels and not letting the brain tissue die. Last but not least, the blood pressure must be controlled, so the aneurysm is closing properly. With that being said, here we finish this episode. I hope you enjoyed it, and if you did, hit that subscribe button to never miss more content like this. A few weeks ago, I uploaded a nice video in which I explain how does MODAFINIL work, the nootropic drug that makes you smart within seconds. If you are curious to find out more about this topic, check the link in the description. Maybe you will like it. Thank you for watching. See you in the next one.